My name is Scott Legget. I'm a co-founder with Global One, and we're here today to talk about how to scale an outpatient arthroplasty program. We are joined today from the Sequoia Surgical Pavilion and a couple of outpatient arthroplasty surgeons from Golden State Orthopedics. We're so happy to have Dr. Johannes Peters. He's Anesthesia Medical Director at Sequoia Surgical Pavilion. Dr. Wendy Wong is one of the orthopedic surgeons who actually is the director of the program. The founder of the program is Dr. Louay, Toma, and the administrator, Shea, Lansberry, who's also a nurse by training. Obviously, Global One has been one of the leaders in the industry now for over a decade in pioneering bundle payments. How's bundle payments working for you guys?
At first, patients didn't really know what they were. Surgeons didn't know what they were. Facilities didn't know what they were. But, working together and making a bundle that actually makes sense to everybody, it makes all the sense in the world. It is an efficient way of doing business.
I think bundles are definitely going to be part of the future. What I like about the bundle is it basically shifts the onus back onto the physicians and the team to make sure that the patient gets the right care from the beginning to the end, because we are responsible for the care. If you're an employer or maybe an insurance provider, you know what your cost is going to be right up front, and you can plan on budget on that. And so I think shifting that responsibility back onto the physician team and the nursing team taking care of that patient, that really makes you think about, okay, is it the right patient? Is this the right candidate for the surgery center? How is the patient going to do? Are we following the right things post-operatively so the patient doesn't bounce back? To me, it's a way to drive value back to the consumer long term. So I like the bundles.
You have to control everything from cost, plus reduce complications and things like that. So there's a lot of variables, but everybody works together to make it happen. And it works, like you say, for everybody. It works for the center, it works for the surgeons, and the patients really should find themselves in a better quality environment. I think we've been very happy with it. And frankly, we will want to be doing more and more of it.
2020 of January, we moved total knee replacements to the surgery center. And so now we work a lot with our vendors in making sure that our implant cost is conducive to what our reimbursement is.
So every piece of the standardization is really what lowers the cost. Actually, arguably improves patient outcomes because you're consistent with the care and it lowers costs at the same time.
I would say that the hospital actually benefited from the fact that we learned how to do bundles right. And they're reaping the benefit of that because we're doing basically the same process at the hospital. But like you say, obviously financially, it's the hospital gets more of the pie.
I like the fact that the bundles we're doing at outpatient centers, a lot of that win and margins goes back to the facility and the surgeons, so they have a lot more skin in the game. And I think that's where the win comes back to the bundle, because you probably put a bundle together much more cost effectively for an outpatient center than a big hospital system.
It's an opportunity, and so we should take advantage of it and really be the driver of where the bundle is going in the future.
There's bipartisan efforts to actually create legislation on transparency. And transparency right now, as we know, is basically just pricing on codes, what the hospitals are charging, is what this particular executive order does. And it really is confusing because there's so many different codes involved with different procedures. So how do you guys feel like bundle payments will ultimately play a role in the whole transparency discussion?
That's going to be a game changer. All of a sudden, you're going to have health systems are going to have to publish what their rates and their charges are. And it's been sort of a black box up to this point. I think it's going to bring costs down, and it's going to make the market a lot more competitive. And I think outpatient centers are going to benefit from that.
And wrapping it into a definable fee, right? This not just a bunch of different codes, is the ultimate transparency play.
I think surgery centers are already in front of the game when it comes to that transparency. We really work hard at controlling cost so that it is affordable for our patient. I think we're ready when it comes, and the bundle payments help with that. And again, like I said, partnering with your vendors and everybody knowing what it is exactly, what I'm getting paid, what my cost is, what my reimbursement rate is. It's all right there in front of everybody, and obviously we want the best for the patient.
So involved in bundle payments comes outcomes and being able to track the outcome piece with the payment piece. So Dr. Wong, I know that you've been a big proponent of patient-reported outcomes, and You've tied that back to your practice, being collected at the surgery center too. So can you tell us about that and what's your drive to get that program going?
Yeah, that was one of my projects for the practice with our 32-man orthopedic private practice. It's not easy to implement and get everybody on board, but I think once you let your partners know the value of it, and all the academy, all the studies are reporting patient-reported outcome. That's kind of the standard now, and so I think as a practice we wanted to be ahead of the game and start collecting them. And I'm probably one of the few people that really truly care about it as much to put the time into it, but it benefits the whole group, and the patients. And so just getting a platform that's easy to implement, that is doing as much of the collection automated as possible, so that it's decreasing the load on the surgeon and the staff. And so, but ultimately I think it's going to become the standard and the requirements in the near future. So getting ahead of the game and really being able to control your data is going to be the key, right? As a group, instead of letting the hospital control it and then taking charge to collect it and make sure we have good compliance rate and then reporting it to AJR. I think those are all going to be the norm now in a couple years.
Do you collect that yourself or do you use a third party?
We have a platform that a vendor that does a lot of the automation pre-op, right, around a surgical episode, hips and knees and shoulders, and also for spine, which is the next thing, and doing it post-op at the standard intervals that's required by AJR. And then they report the data for us.